Next chair recognizes the gentlelady from Indiana, Ms. Brooks, for 3 minutes, please.
Thank you, Mr. Chairman, and thank you, Ranking Member Green, for hosting this incredibly important hearing. Too many Americans are struggling with the crippling effects of drug abuse and addiction, and the statistics, as we know, are devastating. According to the Indiana State Department of Health, every 2.5 hours, a Hoosier is sent to the hospital for an opioid overdose. Across our state, there are enough bottles of painkillers in circulation for nearly every Hoosier to have their own. And the number of infants born addicted to opioids is increasing at an alarming rate, with health care costs for these babies costing Indiana more than $64 million in 2014 alone. And as we know, like so many other states, Hoosiers are now more likely to die from a drug overdose than a car accident. When I came to Congress in 2013, I've been very focused on our communities and families that this epidemic has swept up. And like so many of my colleagues, we've held roundtables, we've held meetings, we've met with addicted individuals, families, we've been in the front line with prescribers, healthcare workers. We all agreed this is a federal problem and a local problem. Last year, we passed CARA, which included my bill to establish an interagency task force to review, modify, and update the best practices for pain management and prescribed pain medicine. HHS has already taken steps in forming this task force, but more needs to be done. In my view, it's critical to ensure that the medical professionals have continuing medical education for the prescribing of DEA-controlled substances that have such a high risk of abuse. I'm exploring options to ensure that physicians and other medical professionals who prescribe these scheduled drugs have more and better education linked to the application and renewal of their DEA licenses. Professionals who prescribe and dispense opioid medications must have better training so that they fully understand those patients who sadly have gotten the onset of addiction due to what they've been prescribed, and now they need even better education to help prevent that onset and then help them with the addiction. Indiana is tackling our problems head on, and in fact, just yesterday, Indiana University announced a new initiative called Responding to the Addictions Crisis. It's being led by IU's Dean of Nursing, Robin Newhouse. IU is committing $50 million over the next 5 years to collaborate with state and community partners to tackle this crisis. It is going to be one of the most comprehensive state-based responses, and every IU campus in the state is going to be involved. It's going to focus on training and education, data collection and analysis, policy analysis and development, addiction sciences, community and workforce development. So major steps are being taken across our state because everyone has a role to play, from our prescribers to our medical, to our higher ed institutions. And I want to remind folks that DEA has a National Prescription Drug Take-Back Day. It's approaching on October 28th. It provides that safe, convenient, responsible way to dispose of excess prescription drugs so that people can get those drugs out of their medicine cabinets and out of our kids' reach. And not just kids, to adults. So there are going to be locations all across the country, and I really encourage everyone, because everyone has a role to play. And so October 28th is National Take-Back Day, and I hope that we get that word out. Thank you, Mr. Chairman. I yield back.
Very well. And of course, thank the gentlelady for providing the date. This hearing is being streamed on Facebook Live, so your information now has been distributed to everyone who's been tuning in this morning. So that's a good thing, and perhaps we can each individually try to make that date part of our discussions as we go through the rest of the month.